Our first question is for Dr. Giese. One parent wants, quote, tips on healthy eating. My high schooler skips breakfast, nibbles on junk food at lunch, and eats one good meal a day. Any advice on how to fix that? End quote. What advice do you have for that parent, Dr. Giese?
Well, first of all, congratulations. It's a great thing that your teenager's eating one good meal a day. I guess in this instance, what I would focus on is sort of what you have control over. You do not have a lot of influence at lunchtime. Your teen's going to make the choices that they make, and they're going to be in a hurry potentially a lot of the time at school. But you can definitely change that morning routine and how things go in your house. One of the things I really suggest is stocking your house with grab and go items that are healthy, that your teenager can eat in the car, on their carpool, hopefully not while they're driving, or, as they're getting to school. Smoothies can be a great option there. Protein bars, yogurt, there are lots and lots of options. And the best thing to do is to take your teen shopping with you and have them pick some of those things out.
Thank you. Besides eating, parents of teens often complain about their sleeping habits. One parent wrote in, my teen gets up at 6 a.m. for school, but wants to sleep past noon on the weekends. Is that okay? What do you think, Dr. Colen?
Well, that is an issue that I would think most teens have. When I talk to most of my teens, they're getting up early for school, and they think that making up their sleep on the weekends by sleeping till noon, is okay. And there have been a lot of studies showing that sleep, most Americans don't have great sleep habits, and actually consistent sleep is the best and healthiest, both for your physical health, mental and emotional health. So, trying to get kids on some kind of a schedule on the weekends. Now, some have activities that they have to wake up for if they're in a sport, especially. But sometimes the kids that don't really have much to do, sometimes it's good to just try and, plan something for the weekend, maybe have an activity, something they like to do that they'll look forward to getting up a little bit earlier, to try and keep their sleep cycle a little bit more in sync. Now, obviously, sleeping in a little bit later on the weekend is realistic. But again, we want to try and have more consistent bedtimes and wake-up times, whether, a weekend or during school. So sometimes just getting the shades open, and somehow getting their feet on the floor. Once they get going, it's a lot easier. And again, screens are a big thing that we try and avoid, because that tends to trick your body into, thinking it's daylight when it's night. So we really want to try and keep screens out of the bedroom as well.
All right, sage advice. Thank you very much. Dr. Grunenwald, this one is for you. One parent writes in, my 13-year-old daughter is getting so wrapped up in social media. How do I discourage this without being too extreme? For example, taking the phone away. What do you say?
Yeah, so social media, like it or not, is in one form or another probably here to stay. I think all tweens and teens need a way to communicate with each other. It's a big milestone for kids at this age, that they're learning, forming these friendships and all this kind of stuff, outside of their family. And they do need to learn to do those things. And social media for this generation is one of the ways that they communicate with each other. For me, being a wee bit older, you know, if your family had 2 phone lines, you know, that was the awesome thing. Now, you know, kids have access on their own, you know, pads or phones or what have you. And as we all know, you know, technology has benefits and bad aspects to it. So I don't think the social media in and of itself is always bad, but exactly like helping your kids learn healthy ways to use it, healthy ways to look at it, because as we all know, like with people posting pictures, you know, kids at this age are notorious for comparing themselves to their peers and others. And that's a normal aspect of that age as well, but often can affect their self-esteem. So you want to know what these social media websites are. You should be, especially when they're young and wanting to join some of these things, if they're old enough, you should be doing it with them, watching how it works, what gets posted, what people can or can't say back and forth, because as we all know, there can be a lot of bullying or negative comments and stuff. I think when your kids are younger, you know, maybe one of the criteria for them to be able to be on social media is that they have to accept you as a friend, so that you can kind of monitor and see what they're posting and see what's going on there. As they get older, you know, you give them a little more privacy, but as you go along, you're teaching them the aspects of, you know, what is real and what's not, what's posted in pictures with filters versus, you know, all that kind of stuff. So that body image, you know, is not a big problem, or just being jealous of everybody else's life seems perfect in these pictures that we post, right? We need to teach them that nobody posts when they're feeling crummy and laying in bed and is upset and crying. They always post the things that look good and are going to make them look good. So those are just conversations you have over and over, and use these teachable moments about, you know, appropriate social life on social media.
Thanks. Wow, 2 phone lines when we were growing up was a luxury, TM.
I know.
We just had 1 phone line, but it had a really, really long cord. So that was helpful.
And party line.
Exactly. There you go. Dr. Giese, we're going to go back to you for another question about eating habits. One concerned parent appropriately wants to know, how do I get my teenage daughter to eat healthier without setting her up for an eating disorder later?
That's a great question. So we just talked a little bit about body image. I think really focusing on the body's function is the key here. One great tip that I give to a lot of my patients is to go see a dietitian. We have a fabulous dietitian if you're that works with PediaTrust. If your pediatrician is a PediaTrust pediatrician, and there are lots of different reasons I send children to a nutritionist or dietitian. But one of them is really to learn sort of what kind of fuel their body needs. So I recently had a patient who was incredibly active, really, really sporty, and just wasn't getting enough calories. They went to the dietitian, got like a set meal plan, learned what they needed to eat, and things are going much, much better. I think really focusing on the function of the body, and then also being careful not to compare or make comments about bodies. I think the more we learn, the more we know that there's a lot we don't have control over, and we really shouldn't be comparing ourselves to anybody but ourselves.
Good advice. Thank you. Dr. Colen, you were once a teenage boy, as I was. From this question, I'm guessing this comes from someone who was never a teenage boy, a mother who asked, can boys experience hormonal changes which can impact behavior and feelings?
Well, absolutely. You know, I think we think a lot about females more often as sort of the, you know, premenstrual type things and behaviors. And we talk a little bit more about females, but absolutely males can. As testosterone, as well as other hormones, are very powerful as far as brain functioning. Testosterone can play a role in behaviors like aggression, competitiveness, self-esteem. I mean, there are a whole bunch of things. So certainly, as boys are going through pre-puberty and puberty, we can expect to see a lot of changes in behavior. Not all negative, but, we typically hear about general teen moodiness and those kind of things. And I think just sort of understanding that that's a part of being a teen and a tween. If we start to have changes that are affecting things in a negative way, whether it's socially, emotionally, school, I think we need to try and have an open dialogue. And teenagers don't always want to talk to a parent, but at least letting them know that you understand, that you've been there before, and letting them know you're available to talk, because again, we're parents, and sometimes we feel like we want to be more friends with our kids, and where's that line? So, but absolutely, as we're, hormones do play a big role in, changes in behavior and emotions.
Thank you. Dr. Grunenwald, here's another question about teenage boys. My son spends a lot of time playing video games with others online. I'm worried he won't be able to form real friendships. How can I get him to be more social in real life?
Right. And while probably stereotypically it's more boys that play video games so much, there's a lot of girls that are into those video games too, because there's lots of different kinds of video games. But I would say, again, like the social media, video gaming is a big thing. It's fun. It's competitive. The video gaming itself isn't necessarily evil. But as with all things in life, it's balance. First of all, I would say, again, like with the social media, as parents, we should try to get involved and see what are these video games that our kids are playing. The younger they are, you really should know what they're playing and what they're being exposed to, because some are too mature. The content that they have, the violence that there is and that kind of thing. So make sure you know the rating, and use parental controls if you can to not let them access stuff that's not appropriate for their age. But try to play some of those video games with them. First of all, it's fun and some activity you can do with your kids, and I think they can enjoy the fact that you're like some of the things that they're interested in. And again, every time we do stuff with our kids, there can be teachable moments through those things where you're not necessarily judging them, but you're talking about something that you're seeing. So if there's some real violent violent stuff, you can talk about, violence. If there's stuff that seems, maybe putting down other people or bullying or whatever, you can talk about those and use them as teachable moments. But let's go back to like making real friendships and stuff. Just like any other thing that people do, there's got to be balance in our lives. We all need to be outside getting fresh air, getting exercise, getting homework done, spend time with family, get chores done. So I think there needs to be time limits on the amount of video game time that that kids use. And then, hopefully you're having these discussions about, in-person friendships. But I do think some of these video gaming things, there are ways that they talk with each other through these like Discord and other, I don't even know what that's called, but and they can actually even go play video games if that's what they're really into in person. So you can kind of form some real life friendships through video gaming as well. So it's all stuff that we as parents shouldn't be afraid of or just automatically dismiss or say that it's all negative, but get to know it and then just talk about balance in people's lives.
Thanks. Very good. All right, we got several questions about school performance. And this one is for Dr. Giese. What are some steps I can take to prepare my teen for college and independence?
So I think this is a great question. And it doesn't so much focus on the academics or school performance, but really sort of like, does your child have the basic skills that they need to get through all of their activities of daily living when they're not in your house? So a few items that I kind of thought and pulled out were, I think the most stressful thing for kids and parents when they're away at school is that first time they get sick. So making sure that your child knows what to take if they have a fever or body aches, or where they should go. Maybe if they routinely have different issues, packing up a med kit, labeling things, you can even kind of help them go through it and provide them some instructions. Also knowing where to go. Most of the college campuses have really good health centers that are targeted at providing care for teens in their age group. Those centers are happy to communicate with pediatricians at home if they need to, in cases of serious illness. I think the other thing that's really important is making sure that your child's prepared, again, to sort of go out and provide themselves nutrition. Many times students will have a meal plan of some sort, but they'll be able to make a lot of choices within that cafeteria or grab and go or grill, wherever they're going. So one of the things is just food choices. Again, what kind of foods are you going to eat to fuel your body most effectively? And then another is making sure that they know how to make some basic meals, that they know how to make some things that they can have in a pinch if there's a kitchen in their dorm or in their common house or apartment, and also how to shop for those things, to shop for the food to make those meals. So really kind of getting them involved, maybe them assigning them a night to make dinner. I know that teens and tweens are always busy, but one of our favorite family activities is cooking together. So really getting them involved in that. The last thing I would say is make sure if your child has any health problems or takes any medications, make sure that they are, that they know what those are, and that they know how to just generally manage them. Some kids need to get medication that has to be refilled every month. Where are they going to get that refilled? How are they going to ask for the refill? Can you get them medication that's filled every 3 months? I think as kids, kind of what the trend I see with my patients is that freshman year, many of the parents are doing this management for the kids. And as they kind of move into their sophomore year, the kids really start to take over the management of medications and refills. And they learn how to message on my chart, because for many of my patients, I'm still managing their medications while they're at college. I mean, other things, again, just sort of really hygiene. So making sure that they can wash the dishes, do laundry, just kind of the basics.
Those are all very good points. Thank you. Okay. Dr. Colen, this one's for you. One parent sent in a question that we all have at various times, asked ourselves, how can I tell the difference between normal teen moodiness and depression?
That's a very good question. And sometimes there's a little bit of an overlap. But I would say in general, moodiness tends to be those fleeting kind of, like we all have bad moods, but they're general overall, and you all know your kids best. So for example, somebody that, maybe is in a sport, is doing pretty well in school, has an active social life with friends, suddenly grades are dropping, they're withdrawing from friends, you know, their typical general mood for the most part doesn't seem to be what it was, then I'd be a little bit more concerned about depression and sometimes even anxiety. Anxiety and depression can go along hand in hand. You know, there are those kids that will tell you that they're depressed and it's very obvious, but what's hard is sometimes those subtleties. You know, most pediatricians will, you know, do some type of a depression screen during visits, you know, asking questions about, you know, sleeping, eating, you know, do you generally feel sad? And depression isn't always, I'm just laying in bed crying. You know, it can manifest in so many different ways in different people. So I think knowing your child, and again, it goes into being involved, you know, without being overbearing, you know, aware of their social situation, things that are going on in school. And if we're starting to suddenly see things that, you know, this isn't, you know, the way, you know, things usually are, you know, then we might be a little bit more inclined to think about depression. And some kids, you know, will be very open if you let them know that you're there for them and you can talk about anything. And again, sometimes just general moods, you know, they're a little bit more fleeting here and there. And some kids sort of just want to be left alone and kind of be in their mood. But it is a good question. And sometimes it is not always that easy to tell the difference unless somebody is, you know, really majorly depressed or, you know, majorly anxious.
Thank you. As a follow-up to that question, Dr. Grunenwald, one parent wrote in earlier, when do you seek teen counseling? And as an adjunct to that question, we had one come in tonight live from one of our attendees who asked, it's somewhat related, how do you teach your kids to become resilient in life? What do you have to say to those two questions?
Yeah, I mean, those are both excellent questions and ones that probably come up on a daily basis when I'm working. And, you know, since Dr. Colen just talked about depression, I'm going to just touch a little bit on anxiety, which I think is probably even more commonly we see in our practices, and it's starting at much, much younger ages. But really, you know, anxiety, I would say, is kind of this disproportionate reaction to normal developmental experiences, right? So all kids, you know, have fears over thunderstorms or thunder and lightning, or, you know, maybe their parents leaving and having a babysitter, or, you know, those kind of things. But it's when the reaction is so out of proportion to you know, the circumstances, and it continues and it interferes with daily living or functioning, you know, that anxiety becomes a problem or an issue or something that should be just, you know, addressed more. And I would say in general, when it comes to counseling, I would say there's almost never a time that it would be too early to seek counseling. If you're asking me that question, I'm assuming that this has, you know, been an issue or a concern or a problem for a while, probably. And really, that whoever asked that question parent-wise tonight was very astute, because that's what counseling is kind of all about, is about helping your kids and you as parents recognize where their feelings are coming from, the physical symptoms that they're having that are being caused by, you know, their mental health, that mind-body connection, because that's huge, just to recognize that, because then they teach you and help teach you these coping strategies to help decrease your anxiety or help, you know, get rid of your depression or work on depression symptoms. And resilience is a huge thing. If it were easy, you know, to teach our kids, or if there was a medication that we could give them that gives people resilience, you know, it would be easy. But really, I think, especially with anxiety, helping our kids become resilient is partially by walking this fine line of not making too many accommodations for them when they're anxious. So if we always allow them to avoid that anxiety provoking whatever it is, you know, going to a sleepover or, you know, not having to do a speech in high school or whatever, then our body is thinking, okay, I need to just keep avoiding these things. So from a very young age, I think we start to teach our kids resilience by, even if they're afraid of something like getting a shot or going to the dentist or whatever, saying, hey, it's okay to be afraid of that. And you're going to be fine because this, and because you have support and all that. And then telling them what a great job they did, and they should be proud of themselves and that kind of thing afterwards. That's teaching resilience. So we start this before you see a problem. You start building on that from a very young age.
Right. And I think the only thing that I would add is this is something that kids pick up from their parents as well. So if you model it for them, when things are not going well for you, when you've had a setback, when, you know, life is tough for you, and yet you muddle through without falling apart, which, you know, sometimes it's hard to do. But if you show resilience, that models it for them as well. Not always the easiest thing to do, but it is effective. All right, we got lots of questions about what is and is not normal at this age. One such question is, what is the most common age for girls to get their period? Dr. Giese, what do you have to say? You're on mute.
Sorry about that. The most common age is the 12 to 14 range, probably the earlier side of that, 12 and 13 being really the most common. If you look at the bell curve for when girls get their period, it does range from the age of 8 to the age of 16. And so there's that kind of the early bloomers and the late bloomers. And much of that depends on sort of the trajectory that their parents took in terms of when they started puberty and how long it took to kind of get through it. And so we see a lot of variation, but it's something that, generally speaking, I would say I start talking to my patients about it at least at 10. By 11, I'm telling them to be prepared, make sure that they know what to do, who they would go to if they were in a situation, if they were at camp or things like that. And I think most schools really talk about it in that 10-year group. So if we do see girls that are on the early end, I definitely pull it out and make sure we talk about it earlier. And I think it is, I don't think there's any age really that's I don't think 8 is too early to start talking to your kids about this in an age appropriate way. So that answers the question.
It does. Thank you. Along the lines of quote unquote normal, Dr. Colen, what do you tell the parent who asks, when should boys start wearing deodorant? And are there certain brands that are safe or recommended at this age?
Yeah, so that's sort of individual. I mean, probably for boys, anywhere from 9 to 14, as we're starting to go through puberty, you know, we start to have an odor. I usually am hoping that they're, you know, my tweens and teens have good hygiene as far as showering and, you know, brushing their teeth. But generally, if we're starting to have some odor as we're going into puberty, would be the time to start wearing deodorant or antiperspirant. So deodorant is just going to sort of, you know, give you a good smell. Antiperspirants are going to help to prevent perspiration. There's really no one better than the other. Some people do react to certain chemicals. So any rashes that develop or irritation, you know, we obviously want to switch products. Some people want to go more natural, like paraben-free. You know, there are brands like, I'm blanking on the name now, Tom's, I think, A lot of people like Axe, that's a big name, but there's not any specific, I think whatever smells nice, to your child. Some people do have a condition called hyperhidrosis, where they really sweat. It's very embarrassing. And there are medicated, antiperspirants, one called Drysol. So occasionally I will use those for kids that say, I can't even wear anything gray because I'm sweating through my shirt. But again, the age is pretty individual, and, just important to look for any kind of, irritation once you initially start something.
All right, thank you. We're going to go back to Dr. Giese for right now. We got a question that came in earlier in response to our discussion on depression. One parent asked, how can you tell the child is self-diagnosing for depression based on what they hear in school or on the internet? What do you have to say to that parent, Dr. Giese?
Well, I think there are a lot of different techniques we have. We're definitely doing some screenings. I know in our office, we do some formal screenings that are designed to be more objective. I also think consistency is a pretty good indicator. It would be uncommon for you to see your child, really sort of, it's common, but it's not depression. Sad about something and really down one day and then totally fine the next. So I think, we kind of talked about this earlier, but really kind of the same behavior day after day, demonstrating the characteristics of depression. The other tool that we have that is fabulous is neuropsych testing. We refer a lot of our patients to neuropsych testing. They do screenings and pretty complicated screenings that you can't fake. They're kind of uncheatable screenings for depression, anxiety, ADHD. They actually can look for a whole host of mood disorders, learning disorders, behavioral disorders.
Thanks. Here's another question about sleep. And this one's for Dr. Grunenwald. How do sleep patterns change as the children age?
Right. So if you guys are tuning into this, I'm assuming probably have either teenagers or tweens by now. So, you've all been through the newborn, infant, preschooler kind of ages. So we know, right? When we bring a newborn from, the hospital home, that's almost all they do besides eat is sleep. So they sleep probably, 15, 16, 17 hours a day. And then as our children get older, the amount of sleep that they need in a 24-hour period is decreasing. When kids are still in that kind of toddler stage and still need naps, they still probably need about 12 hours of sleep at night, and then maybe a good, 2 to 3 hours of napping during the day as well. Typically, most kids give up any nap maybe around 2.5 to 4. There's always outliers there, but so elementary aged kids, maybe up to age 12 probably should be getting still a good 9 to 11 hours of sleep at night. So that means they really need to probably be in bed on average, maybe around 8 or so, depending on when they get up in the morning. And then, our teenagers, and even us as adults, really should be getting at least a good 8 to 9 hours of sleep at night, which is not easy to do with people's schedules, as we all know, right? Unfortunately, internally, sleep cycles change so that teenagers oftentimes with their chemical makeup and hormones and all that, their body is maybe not saying it's tired or ready to go to bed until pretty late, sometimes 11, midnight. For some people, it can even be later, which is difficult because, as we all know, our high school students are the ones that probably start the earliest for school, so have to get up really pretty early, and it makes getting enough sleep very difficult. As Dr. Colen mentioned before, talking about sleep or sleeping in, you know, it's awfully tempting to sleep in for those teenagers when they feel like when they aren't getting enough sleep on a regular basis, but that can throw off even more their sleep cycle, you know, if they're sleeping in till noon. And another thing that I think really I hear about a lot at the office with teenagers is that, you know, coming home from school and being so exhausted and taking a nap in the later afternoon. And that is, you know, a recipe for disaster as well, because oftentimes then, you know, they're not able to fall asleep till well after midnight and get really off track. So I would highly discourage taking naps in the afternoon, especially on a regular basis. And again, sticking with as much of a schedule as possible to kind of keep people on track as far as trying to get enough sleep. Because again, as Dr. Colen mentioned, it's really important for our physical well-being as well as our emotional and mental health. So.
Thank you. Let's see. Here's another one for Dr. Colen. We had a question come in tonight from a mother who said, my child just turned 11, but was before this having outbursts with mood changes. How can I calm him and navigate through these mood changes?
Yeah, so I think, you know, again, that can be very tough. So, you know, I think there's sort of moodiness, and then there are outbursts in anger which need to be dealt with. So, and sometimes again, you know, there's that fine line between, you know, what's just a bad mood and what's lashing out, being disrespectful, you know, and sometimes that can be, you know, a sign of some anxiety or depression, or somebody that really needs some therapy. So kind of, it's really so, what's the word I'm looking for? It's so individualized. You know, if you're able to just really have an open dialogue, you know, in this mom's case, being able to kind of calm, you know, her 11-year-old, talk about, you know, okay, let's talk about what's going on, what may have precipitated this, you know, what is sort of appropriate behavior. Again, you know, respectful versus disrespectful. You know, kids that will sometimes swear at their parents, or, you know, any kind of foul language. You know, there are certain things that just, you know, border on normal moodiness to, okay, this is not behavior that's acceptable. And again, sometimes we need to navigate this with the help of a mental health professional. Unfortunately, there is such a need because we have so much anxiety and depression, and, you know, I think it was always that way, but COVID didn't help anything with social isolation and, you know, things like that. So it's sometimes a tough spot because, again, with mental health specialists, sometimes, you know, there's a wait. I have so many people saying, you know, I can't get my child in to see somebody, you know, for 6 months. But I think, again, the bottom line is if you can have a dialogue and really talk to your child and help them to open up, so you can sort of see, you know, okay, where is this stemming from? And again, it's fine to be in a bad mood, and we all have those, but also explaining the behaviors that aren't appropriate, as I mentioned. But again, a good question, and not an always easy one to answer.
Right, and if I could, I would say one other thing is that most of our PediaTrust offices, we have either live in person or with a virtual visit, the ability to connect with a therapist, mental health counselor, psychologists that we have on staff that work at many of our offices, so that, if you do find that the situation is untenable at home and those techniques that Dr. Colen just mentioned don't work and you need the next step, then be sure to mention it to your pediatrician, and we can hook you up with one of those mental health professionals to talk to your tween about that. All right, here's a tricky one. Speaking of behavior issues, for Dr. Grunenwald, how do we handle situations where the child will listen to instructions but choose to ignore them? And you're on mute.
Sorry. Okay. Right. So just as our kids get older and go from babies to toddlers, we aren't feeding them anymore, right? They're choosing what to put in their mouths and eat. It's the same kind of thing with our kids doing what we ask them to do, whether it's chores or homework or just overall behavior and that kind of thing. So we can't necessarily force them to do these things, but that's where I'm sure we all realize kids are going to learn from consequences, right? And I, as a parent, felt like trying to stay one step ahead of my kids was probably the most challenging thing because, you realize that, oh, we've got a problem here. And I often tell parents, you need to sit down at a neutral time, not when you are reacting to your child's behavior or they're, are refusing to do stuff or what have you, but at a neutral time when you can actually give, and it can sometimes only be 10 or 15 minutes, doesn't have to be that long, but when you can actually sit and think about how are we going to handle this problem or behavior, and maybe come up with a few consequences, and really obviously they'd be based on your child's age. So for instance, it could be taking away a privilege, taking away maybe technology, maybe for older teens, taking away, the car keys, or those kind of activities that they look forward to. And then also, obviously, a consequence has to be, the way a consequence works is that the kid has to realize that their choice was what made that consequence happen. Not that their parents are mean and that they're just doing, making them do certain things, but it was their choice and they have some control over it. So after you spend that time coming up with, these are going to be the consequences if this doesn't happen or does happen, then you need to involve your child in that and say, hey, can we talk about this? You haven't been cleaning up your room. We've asked you to a bunch of times and whatever. So these are going to be the consequences if you make, this choice. And, if it's bad enough, sometimes everybody signs a contract and then you can go back to that when it happens again and they're angry that this consequence is happening. You say, but remember, we talked about this and this was your choice. So I think it's kind of common sense, but not always easy, and certainly doesn't work always the first time. So consistency is really important, but take the time to think things through or even talk it through with your child about why these things are happening or not happening.
Thank you. We got several questions on this next topic, and we could probably do a whole hour just on this, but I'm going to ask Dr. Giese this question, and it's fairly straight. There's a lot of questions in here, so bear with me, Dr. Giese. Acne, is there a way to prevent it? Are there certain foods to avoid? And do all teenagers automatically get acne?
So I'll start with the last part. Yeah, pretty much all teenagers get acne. So their bodies are going through hormonal changes, similar to, for the moms out there, what your body went through during pregnancy. So all sorts of strange things happen in puberty that we know about. And one of them is acne. Some kids get it to a greater extent than others. And definitely is more problematic for some kids than it is for others. There's really nothing you can do. I guess good hygiene will help manage it. It's not necessarily going to prevent it. Some kids are just going to have the kind of acne that is really difficult to treat. There are a lot of treatments for acne, which is fabulous. So I know in our office, we typically recommend that the teenagers start with us, and we kind of go through the hygiene routine. We talk about not so many teens are going out into the drugstore and buying sort of whatever says it'll clear up your acne, and then they're using it all. And we really talk about using a gentle cleanser, making sure you're using an oil-free moisturizer, because over drying your skin will actually increase the sebum production and the oil production that will lead to acne. And then there are some topical lotions and gels that we can prescribe in the office, or give you instructions on, you know, exactly what to purchase over the counter. So that is where we start. If that does not work, there's sort of a next level of acne management, which goes into sometimes oral antibiotics, topical antibiotics. And then the next tier up from that are kind of the dermatologist only treatments, which would include Accutane and Accutane, pretty much.
Right.
So yeah, I think I do occasionally see a few kids who look like they didn't have any acne, but most get it.
Okay, here's a very good question for Dr. Colen. When should girls get the HPV vaccine?
Okay, very good question. So the HPV vaccine, which stands for human papillomavirus, and there are many different strains, but the strains of HPV that are in the vaccine usually prevent some of the most virulent strains of HPV that are responsible for obviously cervical cancer in females, but as well as a lot of even cancers in boys, head and neck cancers, throat cancer, tonsil cancer. So girls, the vaccine is approved as young as 9. We generally offer it at 11, which is when we do some booster vaccines. Now, it's a very safe and a very effective vaccine. In fact, the rates of HPV have decreased since the vaccine has been given. And because younger kids mount a more robust immune response to the vaccine, they only need 2 doses if the first dose is done before the age of 15. After the age of 15, they don't mount as good of a response with only 2 doses, so they need 3 doses. And these are given over a period of, you know, at least 6 months, usually between that first and second dose if you're doing 2 doses. The unfortunate thing is a lot of parents don't really understand the importance of the vaccine. I think they feel like their child needs to be sexually active because one of the main ways that HPV is transmitted is through sexual activity. But I really try to explain to parents that this is something to be done long before, when your child is not really at risk, because once you have HPV, the vaccine isn't really going to do you any good. And HPV is one of those viruses that can really cause no symptoms until later in life, again, when it manifests as certain cancers, you know, and really it is so important. So I, again, try to talk to people about, you know, why they feel like they want to wait or they don't want to do this vaccine, and try and dispel a lot of myths that it's not a vaccine that's going to make you feel like your child's suddenly going to have a license to go out and have sex at age 12. You know, this is really, you know, a breakthrough vaccine that really is a cancer prevention vaccine. And along those lines, I think somebody had mentioned when would be the time for girls to see a gynecologist. The American College of Obstetricians and Gynecologists recommends a visit between 13 and 15, more for just general education as girls are going through puberty, you know, menstrual periods, just to sort of talk and to educate. Not really, you know, pap smears aren't, you know, really recommended till at least 21. So even if kids aren't, you know, sexually active, obviously there are girls that want to talk about birth control, and obviously, you know, that would be a time to see a gynecologist. But for sort of a general, like how you come to your pediatrician once a year or are supposed to, you know, in general, 13 to 15 is what is recommended by the ACOG. Probably most girls at that age have not yet seen a gynecologist. So sometimes it is a little bit more individualized.
And, you know, as the father of 4 daughters, I would say, you know, don't be too alarmed. I know 13 sounds a little young to be going to a gynecologist for some, but you can shop around and look and see. Some gynecologists don't do bimanual exams that early. There's other ways at looking at the uterus or the internal organs, the ovaries, you know, with an ultrasound and whatnot. The technology is so good nowadays. So it may not be as invasive as you think. So if there's a reason why, certainly take them to see the gynecologist, but even if not, 13, 14, 15, not too young, and it may not be as arduous and as invasive as you may remember it being all those years ago.
Right, it's a lot of times it's more of an educational, you know, to
exactly.
have that conversation with a lot of issues.
Okay, Dr. Giese, here's a timely one for you. How do I help my 13-year-old with post-pandemic social anxiety?
Sorry about that. That's a great question also. I definitely see a lot of kids who are having sort of difficulty with re-entry, we'll call it. The things that I found that are most helpful are letting them choose sort of, okay, so maybe you were doing these activities pre-pandemic and you were, you know, now you've got a clean slate. You can choose. What did you like the best? Why did you like it? You can have lots of conversations with them. What are your friends doing? Which friends do you think you might want to do activities with? I just had a parent tell me the other night, and I thought this was great. She worked with her 13-year-old to put together a group of friends who would go out to dinner once a week after an activity. And it was, you know, the parents would drop them off and pick them up, and the kids just went and had some dinner and socialized. And that was sort of a nice activity. It was a limited group. It wasn't a giant celebration or party or anything like that. I think the thing you would really not want to do is just, you know, encourage your child to go to the end of year party if they haven't been in school for 2 years. That could be really overwhelming. So stage it and then have them ask when they're done with the activity, am I glad I did that? I think for most kids, they really are. And that kind of gets them out and going back for more.
That's good advice. Thank you. Here's one for Dr. Grunenwald. It's not even a question. I guess it's just a phrase. But it's, quote, fostering healthy romantic or romantic-ish relationships from early on. So what do you have to say to that, parent?
Okay, so, you know, sometimes those types of conversations with our, you know, kids are uncomfortable, or, you know, we sometimes want to put off those conversations until, you know, we feel like we need to have them. But again, I think that, you know, the more that we just talk about, even relationships before their romantic ones, and respectful relationships and stuff like that. And again, we, you know, model that first of all with our friends, with our spouses, with our children. All that kind of stuff is important. And then when you want to start talking about dating and romantic relationships and stuff, I think that it's very important that kids know that, again, people need to be respectful of each other, that it's really important that being in a romantic relationship doesn't mean that you exclude everything else in your life. At first, sometimes when you're in that beginning stages and you just want to spend, you know, every waking moment with that other person, that's pretty normal at the beginning. But it's, you know, very healthy to have other friends outside of your romantic relationship, other activities, that you still, you know, are a person, you know, outside of just who you are in that relationship. That's, you know, a sign of a healthy romantic relationship. Obviously, there shouldn't be issues about controlling the other person's behavior when you're in a romantic relationship, whether it's who you spend time with, what you do, what you can or can't do. So that, you know, they need to know is not healthy, or too much jealousy between people in a relationship. And then, you know, all relationships have rocky patches or disagreements or fights. But how do you resolve that? How do you, you know, handle that? That's an important part of any relationship as well. So I think those are kind of the discussions that you have. I would say for myself, I have 3 girls as well who are older now. And when The Bachelor, that TV show, first came out, at first, of course, my kids wanted to watch that because everybody was. And again, I'm a big believer in participating in what your kids are doing or going through or whatever. So I watched those shows with them, and it gives you so many teachable moments when hopefully they don't necessarily realize that you're trying to teach through that, because you're not talking about them, you're talking about these other people on screen and how, or Real Housewives, right? I would say those 2 shows in particular, you know, they weren't very respectful to each other in how they would handle things. And so you use those, you know, things as teachable moments as well. So that's what I would have to say.
Thank you. All right, I know we're coming up against the clock here. I'm going to have time for one more question that came in tonight through our live feed. And I'm going to send this to Dr. Giese, who was talking earlier about acne. One mom asked, what about over-the-counter treatments such as Oxy? Oh, you're on mute.
You'd think by now I would know. So I believe Oxy is benzoyl peroxide. Benzoyl peroxide is great. The one warning I give to parents is it can be over drying. So again, make sure you're using that oil-free moisturizer, and it can bleach sheets and towels and clothing. So make sure if your kids are using it, that they have a set of sheets and towels that you're okay having bleached if that happens. The other over-the-counter topical that I really like is Differin, or adapalene gel. And actually there's a prescription medication on the market that's a combination of the 2 of those. So you can also use those. Again, you're not using them all over your face. Those are really, you're using them on the spots that need treatment, because if you use them all over your face, they will really, really dry it out and irritate it.
All right, thank you. Well, that wraps up our session for tonight. It's a little past 7 now. So I want to thank our panelists, Dr. Giese, Dr. Grunenwald, Dr. Colen. Thank you very much. Thanks to our behind the scenes staff who made this run very smoothly tonight as well. And as a reminder, tonight's session will be, or has been, recorded, and we will be sending out an email to everybody who registered for the event over the next few days on how to access that recording. So if you missed something or had to step away for a minute, don't worry, the whole hour has been recorded. All right, thanks again to our panelists. And I hope everybody has good luck with their teens and tweens in the coming months. Everybody have a good night.